Welcome. We're diving deep today into, well, what a lot of people are calling one of the biggest battles in modern medicine.
That's right. It's this huge rivalry, isn't it, between Novo Nordisk and Eli Lilly?
Exactly. In the exploding GLP-1 and weight loss drug market, I mean, the projections are just staggering hundreds of billions.
And it's moving beyond just injections now.
Right. The next big thing seems to be these oral GLP-1 drugs. They're right on the horizon.
So our mission today really is to unpack these two pharma giants for you. We'll look at their products, compare them.
And their valuations too, right? That seems key.
Absolutely. Valuations and, crucially, their execution. We want to help you understand who might, pull ahead in this incredibly fast-moving space.
Okay, let's maybe start with the science, just briefly. What makes these drugs so, well, groundbreaking?
It really boils down to natural hormones, incretins.
Incretins, okay.
Think of them like your body's own fuel gauge located in your gut. They signal your brain, hey, you're full, and tell your pancreas to release insulin. Pretty neat system.
But it breaks down sometimes.
That's the fascinating part. For many people with obesity or type 2 diabetes, this natural gauge is, well, faulty. The signal's weak or maybe delayed.
Leading to that food noise people talk about.
Exactly. That constant chatter about food, the difficulty feeling satisfied. These drugs like semaglutide and tirzepatide, they act like a kind of super sensitive fuel gauge.
Okay.
They mimic and really boost those natural signals. They fundamentally recalibrate that whole gut-brain connection.
That complex back and forth controlling hunger.
Right. And the ability to quiet that food noise, that's just monumental for patients. It gives them back a sense of control.
Monumental, yeah. So comparing the current players, the injections we have now, Lilly's Zepbound, 15 milligrams.
Yep, and it's showing really impressive weight loss, around 22%.
Which is currently at least better than Novo's Wegovy injection, 2.4 milligram one. That's about 15%.
That's right. It's a noticeable difference on paper. For you considering these, that percentage gap might seem significant.
But there's a twist coming.
Oh, here's where it gets really interesting. Novo Nordisk has these upcoming oral semaglutide trials.
The pill form.
Yes. And the data suggests a 7.2 milligram dose, just 7.2 could achieve comparable weight loss, like 21%.
Wait, 7.2 milligrams oral giving roughly the same result as 15 milligrams injected.
Exactly. Less than half the dose of Lilly's injection, but in a pill, with, crucially, maintained safety so far.
Wow. That oral advantage? That could be huge.
Massive. Think of patient preference. Most people would rather take a pill than give themselves a shot, right? It could totally change adherence, access, market share.
A completely different ballgame, potentially.
Yeah.
Okay, so beyond the drugs themselves, what about the money side? Wall Street's view. Lilly seems to be riding high.
Oh, definitely. Trading like a darling, as they say. A lot of that future growth might already be baked into the stock price. It hasn't seen much turbulence.
But Novo Nordisk, it's been a bumpier ride.
Yeah. Conversely, they've faced some real headwinds. You've got, over 100 lawsuits about knockoff drugs, plus some operational issues, missed targets that disappointed investors.
Which created a gap in how they're valued.
A definite valuation disparity. Just look at Novo's stock range over the past year, somewhere between $45 and over $135. That's a wide swing. But that pressure, it can be a powerful motivator. It forces management to really look hard, adapt. Maybe they streamline R&D. Maybe they get way more aggressive on manufacturing.
Making them leaner, more agile?
Potentially. And for you, looking at this, it might present an opportunity, right? A chance to consider a very strong company that might be trading at a discount, something your research seemed to touch on.
That's one way to look at the pressure. But couldn't those headwinds, the lawsuits, couldn't they signal deeper problems that aren't so easy to fix?
Absolutely. That's the big risk here. No question. This pressure could be too much.
Right.
But it could also forge a much tougher, more focused management team.
Yeah.
Meanwhile, sometimes too much success can lead to a bit of complacency elsewhere. It's a dynamic situation.
So, wrapping this up, what's the takeaway here? It feels like we're really at a pivotal moment.
A new frontier in medicine, truly.
Yeah. And while Eli Lilly's had this incredible run, almost smooth sailing, this emerging oral drug fight, plus Novo's current valuation discount, and that potential for a re-energized management, it does build a pretty compelling long-term picture for Novo, doesn't it?
It does present a strong case. The major caveat, of course, is execution. If Novo's management stumbles, if they fail to deliver on that oral pipeline,
then the opportunity could evaporate.
Exactly. Delivery is critical now.
So for you, as you're thinking about this really fascinating, evolving market, Maybe go a step further than the reports. Perhaps, try talking to doctors or even patients using these drugs from both companies.
Get that real-world perspective.
Yeah, getting a first-hand sense of how they actually perform, what patients prefer.
Yeah.
That could give you some invaluable clues about where this rivalry is truly headed next.
Interesting. So if the spreadsheets aren't the whole story, what exactly is this human element? Who are we talking to?
We mean the people really truly on the ground. So the doctors who are prescribing these GLP-1s day in, day out, and of course the patients who are actually taking them. These are the folks with, direct experience. They're living with these drugs from Novo Nordisk, from Eli Lilly.
Right, not just reading about them.
Exactly. It's lived experience versus observation.
So what can a doctor or maybe a patient tell us that, a company press release just won't? What's the specific value there?
Well, think about effectiveness in the real world, not just in a controlled trial. A trial might look great, high efficacy, few side effects mentioned, but maybe doctors are telling us, look, patients struggle to stick with this one.
Why, though?
It could be anything, really. Maybe the dosing is complicated, or it needs constant refrigeration, which is just impractical for some lifestyles. Things that maybe the company didn't fully anticipate impacting adherence so much.
Okay.
Or maybe certain side effects, they might be listed as mild in the data, but doctors see they're persistent. They actually affect quality of life enough that patients want to switch.
So they might move to a competitor, even if that competitor's drug maybe didn't look quite as effective in the trials.
Precisely. These are the kind of real-world dynamics that can really shift market share in ways the initial data wouldn't predict.
And you mentioned patients, too. What about their preference? Because I guess it's not always just about which drug lowers A1C the most or causes the most weight loss.
Exactly right. Patient preferences, well, it's a huge factor, a real differentiator. You could have a drug, maybe its purported efficacy is slightly lower, right? But patients love it.
Why?
Maybe the injection is less painful, or it comes in a pen that's just easier to handle, simpler. Or maybe the side effects, while present, are just more manageable day to day. Fewer stomach issues messing up their routine.
Gotcha, the practical stuff.
Yeah, those sort of subtle lived experiences, they can make one product much more appealing. It builds loyalty that's deeper than just the clinical results. It's about fitting into life.
So talking to them helps us understand the why behind the market numbers. We see the reception through their eyes.
Perfectly put. It's beyond just sales figures. Doctors might tell you, hey, I'm getting a ton of requests for this drug for off-label uses, things not even approved yet.
Interesting.
Or maybe patients are coming in really informed, but from like online forums or Facebook groups. And they might strongly prefer one drug over another based on what they've read from other patients, not the official brochures.
Right, the word of mouth effect.
Exactly. That kind of qualitative feedback gives you the real pulse of the market. You spot trends or maybe challenges that aren't immediately obvious but could really impact things long term.
It really sounds like combining these viewpoints, the hard data and these human stories, gives you a much more powerful understanding. So for you, listening, getting this perspective means you're not just seeing numbers on a page. You're grasping the science, yes, but also the patient experience, the market's reaction, the practicalities, and that complete picture, that holistic view, is surely key to being well-informed in a market moving this fast.
Absolutely. These first-hand accounts, they provide the context, the texture, the practical stuff from doctors, the personal stories from patients. It completes the picture in a way data alone just can't. It makes the market dynamics much clearer, more actionable.
So what's the main takeaway here for you? Really, this deep dive is about encouraging a broader view in your own research, a more human-centered approach. Look past the headlines, dig deeper than the balance sheets, think about the people actually involved. We think that's vital for making truly informed decisions. And just to leave you with something to chew on, a question that came up from our sources, considering everything, the data, the trials, and these human factors we've discussed, which company do you think is better positioned right now? Novo Nordisk or Eli Lilly? For the long haul. Something to think about.